right. Precision Opinions Live, and today I'm here with Dr. Evan Shapiro. Dr. Evan Shapiro came out of SUNY Buffalo, right?
Yes.
SUNY Buffalo, and then went on to, you did your residencies. Where was that?
I finished med school at SUNY at Buffalo, and then I came down to Long Island and did my residency at Long Island Jewish Hospital.
Okay, Jewish Hospital. And then you now are the founder of your own practice, Women's Health and Wellness, correct?
Yes. I was in private practice in a group practice for about 13 years, and in 2003 formed Women's Health and Wellness.
Okay, beautiful. So explain the dynamic of the practice, what you do and how you approach it. What's your patient approach as well?
Well, at Women's Health and Wellness, we have 3 physicians. We have a nurse practitioner. I also have a nurse who is a cosmetic nurse, and our approach is towards taking care of women from puberty to menopause, and in many different aspects of taking care of the needs of women, whether it be obstetrical, because we are primarily an obstetrical gynecological practice, of which I am board certified in OBGYN. So we actually take care of obstetrical patients, gynecological patients, GYN surgery. We have patients who, after they're finished having children, approach menopause. We take care of menopausal patients. And we also have a whole cosmetic component of our practice and a nurse who takes care of skin care, tattoo removals. We do offer patients Botox, dermal fillers for enhancing appearance. And we have a full, complete gamut of what we do for women.
Everything women, right?
That's it.
So what we're going to kind of discuss today is bioidentical hormones. I know you're very educated in the topic and you use them a bit. Whether bioidentical hormones, I'm not talking about when people hear that word, they just think compounds, compounding pharmacies. That is an umbrella that there's other brands out there that are actual bioidentical hormones. So explain what a bioidentical hormone is. When people hear that, they kind of don't understand it for the most part.
Well, when we're using hormones to supplement and treat patients with hormonal replacement, you have an option of either having synthetic hormones, which are man-made, made in a laboratory, and they are made and get close to the structure, the chemical structure of the hormones that we normally produce in our body. Bioidentical hormones are hormones that have the exact same structure, chemical structure of the hormones we produce, and they are formed and derived from plant forms and natural occurring substance, but they actually have a structure that mimics the exact structure that we normally produce in our body.
Okay. And so when you use a compounding pharmacy, we can pretty much make that into any type of formula, whether it's a troche, whether it's a capsule, tablet. We can also do creams. So different conditions within menopause, you can use different formulas, and based on their weight, their genetics, and this and that, we can really zone in on their specific symptoms. Is there a certain route that you go for different formulations?
There's no one particular route that I use. I use them all. I find that it depends also what you're treating. If you're treating systemic symptoms like hot flashes, mood swings, irritability, difficulty sleeping, you're using a compound that you may use either in a troche form, a cream form, or a capsule. But many times in postmenopausal women, we're trying to target a particular area like the vagina because of vaginal dryness, painful intercourse, and we're using a cream to use vaginally, and the doses will vary depending on what you're trying to achieve and what symptoms you're trying to treat. But I don't have a personal preference as to which one I use. I also ask patients what they prefer, because some patients would not want to be using a cream. Other patients don't want to take a capsule. They would want to take the creams and use it. Personally, there is an advantage to using cream from my point of view, which is if I want to make some fine adjustments and I want to adjust the formulation, I want to add a little more of the estrogen and progesterone that I may be having in the compounded formulation. I can do it easily with a cream without having to make up another prescription. So I could have the patient take a little more cream, a little less cream, whereas it's very difficult if you have a capsule. You can't do much by changing the capsule. You have to make another formulation.
Exactly. That I feel like that is so useful when you have a patient that's coming in and maybe they have breast tenderness or bloating, and you can easily tell them to use less of a cream or turn something around, increase the estrogen, decrease the estrogen based on levels, and so on and so forth.
Well, the other thing is sometimes if you order a prescription that's a dosage that's made up by a pharmaceutical company, you're locked into a couple of different doses. And maybe the dose that, even the smallest dose, may be more than you want to give to a particular patient. So to get it less than that, if it's compounded, you have the ability to dictate what strength, what compound, what mixture you want to make up, and then adjust it.
Exactly. And you do use some commercially available products, correct?
Absolutely.
And that are bioidentical. We know
Absolutely.
There's some brands out there. But as far as tailoring it specifically to that patient, it's a little bit more challenging.
Yes, my practice is composed of patients that take both. So there are many commercially available products I do use, and there are many compounded products I do use. Again, some patients have a preference, some don't have a preference. And I think there's a falsehood out there that bioidenticals are safer than others. The reality is they're both medications, and you have to be aware of the risks and benefits of taking a medication. But there's a useful place for both.
Oh, of course. I think that's a great note to end on. I want to thank you for coming on. Awesome. I appreciate you. I look up to you as a big physician in the area, and your patients are very happy and they love you. Well, thank you for coming on.
Thank you. It was a pleasure coming, and anytime I'll be back.
All right.
Be sure to search Precision Opinions Live on Stitcher, Spotify, YouTube, and Google Pods. And make sure to follow Precision Pharmacy on Instagram, Facebook, and all other social media platforms.